Picture this, your kidneys are failing, and you don't feel a thing. That's the terrifying reality of chronic kidney disease. It's often called the silent killer because by the time symptoms appear, significant and sometimes irreversible damage has already occurred. Your kidneys are working overtime, filtering waste and excess fluids from your blood, regulating blood pressure, producing red blood cells, and maintaining bone health, all while sending you no warning signals as they slowly deteriorate. But here's the powerful truth. Kidney disease is largely preventable. With the right knowledge and proactive steps, you can protect these vital organs and ensure they continue to serve you well throughout your life. Today, we are going to uncover the critical steps you need to take to stop kidney disease before it starts. This isn't just about avoiding illness, it is about empowering yourself with the tools to maintain optimal health and vitality. Let's start by understanding exactly what your kidneys do and why they matter so much. You have two bean-shaped organs, each about the size of your fist, located just below your ribcage on either side of your spine. Though they're relatively small, their impact on your overall health is enormous. Every day, your kidneys filter approximately 150 quarts of blood. That's enough to fill a large bathtub. From this massive volume, they remove waste products, excess salts and fluids. While carefully maintaining the right balance of electrolytes and minerals your body needs to function properly. Your kidneys also produce hormones that regulate blood pressure, stimulate red blood cell production, and help maintain bone strength. When kidney function declines, these critical processes are disrupted, leading to a cascade of health problems that can affect nearly every system in your body. The scary part is that you can lose up to 90% of your kidney function before experiencing noticeable symptoms. This is why prevention and early detection are absolutely crucial. So what are the main culprits behind kidney disease? The two leading causes are diabetes and high blood pressure. Together, these conditions account for about 2/3 of all chronic kidney disease cases. When blood sugar levels remain consistently high, as in diabetes, the delicate filtering units in your kidneys become damaged over time. Similarly, uncontrolled high blood pressure puts excessive strain on the blood vessels in your kidneys, impairing their ability to function effectively. But kidney disease doesn't discriminate. Other risk factors include heart disease, obesity, a family history of kidney disease, being over the age of 60, and certain ethnic backgrounds including African American, Hispanic, Native American, and Asian American populations, which have higher rates of kidney disease. Additionally, long-term use of certain medications, particularly nonsteroidal anti-inflammatory drugs like ibuprofen and naproxen, can damage kidney tissue when used excessively. Now let's talk about the critical steps you can take to protect your kidneys. The first and most fundamental step is controlling blood sugar levels if you have diabetes or prediabetes. This isn't just about taking medication, it's about a comprehensive approach to blood sugar management. Regular monitoring, following a balanced diet low in refined carbohydrates and sugars, engaging in regular physical activity, and maintaining a healthy weight are all essential components. Work closely with your healthcare provider to develop a personalized diabetes management plan, and don't hesitate to ask for referrals to diabetes educators or dietitians who can provide specialized guidance. The second critical step is managing blood pressure. Your target should be below 130/80 millimeters of mercury, as recommended by the American Heart Association and the National Kidney Foundation. Diet plays a pivotal role in kidney health, and this brings us to our third critical step, adopting a kidney-friendly eating plan. This doesn't mean a restrictive, boring diet. It means making smart choices that support overall health while protecting your kidneys. Focus on whole, unprocessed foods. Plenty of fruits and vegetables, whole grains, lean proteins, and healthy fats. Limit processed foods, which are often loaded with sodium, preservatives, and unhealthy additives. Reduce your intake of red meat and replace it with plant-based proteins like beans, lentils, and tofu, or lean animal proteins like fish and poultry. Stay well hydrated with water, but avoid excessive consumption of sugary drinks and limit caffeine intake. The fourth critical step involves staying physically active. Regular exercise doesn't just help control weight, blood sugar, and blood pressure. It also improves circulation, reduces inflammation, and enhances overall cardiovascular health, all of which benefit your kidneys. Aim for at least 150 minutes of moderate-intensity aerobic activity per week, such as brisk walking, swimming, or cycling. Include strength training exercises at least twice weekly to build muscle mass and improve metabolic health. The key is consistency. Find activities you enjoy so you can maintain them long term. Fifth, maintain a healthy weight. Excess body weight, particularly around the abdomen, increases the risk of developing diabetes, high blood pressure, and other conditions that damage kidneys. Even modest weight loss, just 5 to 10% of your body weight, can significantly improve kidney function and reduce risk factors. Focus on sustainable lifestyle changes rather than fad diets. A combination of healthy eating, regular exercise, adequate sleep, and stress management creates the foundation for lasting weight management. Our sixth critical step is avoiding nephrotoxic substances, things that are toxic to your kidneys. This includes being cautious with over-the-counter pain medications. While occasional use of NSAIDs like ibuprofen or naproxen is generally safe for most people, regular or high-dose use can cause kidney damage. Always follow dosage instructions and consider alternatives like acetaminophen when appropriate. Discuss pain management options with your healthcare provider, especially if you have existing kidney issues or risk factors. Additionally, limit alcohol consumption to moderate levels, 1 drink per day for women, and up to 2 drinks per day for men, and avoid illicit drugs completely, as many substances can cause direct kidney damage. Seventh, quit smoking if you currently smoke. Smoking damages blood vessels throughout your body, reduces blood flow to the kidneys, and increases the risk of kidney cancer. It also accelerates the progression of existing kidney disease. Quitting smoking is one of the most significant steps you can take for overall health, including kidney protection. Seek support through smoking cessation programs, nicotine replacement therapy, or prescription medications if needed. Your kidneys will thank you. Eighth, get regular checkups and screenings. Since kidney disease often has no early symptoms, regular testing is essential for early detection. If you have risk factors like diabetes, high blood pressure, heart disease, or a family history of kidney disease, you should have your kidney function tested annually. The 2 primary tests are a blood test measuring creatinine levels to calculate your glomerular filtration rate, or GFR, which indicates how well your kidneys are filtering waste, and a urine test checking for albumin, a protein that shouldn't be present in significant amounts if your kidneys are healthy. Early detection allows for timely intervention when treatment is most effective. Ninth, manage stress effectively. Chronic stress contributes to high blood pressure, poor dietary choices, and other behaviors that can harm kidney health. Develop healthy stress management techniques such as mindfulness meditation, deep breathing exercises, yoga, spending time in nature, or engaging in hobbies you enjoy. Prioritize adequate sleep. Aim for 7 to 9 hours per night, as sleep deprivation can increase blood pressure and disrupt hormonal balance, affecting kidney function. 10th, be mindful of protein intake. While protein is essential for health, excessive consumption, particularly of animal protein, can put strain on the kidneys, especially in people with existing kidney issues. For most healthy adults, a moderate protein intake of about 0.8 grams per kilogram of body weight is sufficient. Focus on high-quality protein sources and distribute your intake throughout the day rather than consuming large amounts in a single meal. Now, let's address some common misconceptions about kidney health. Many people believe that drinking excessive amounts of water is always beneficial for kidneys. While staying hydrated is important, overhydration can actually be harmful, particularly for people with advanced kidney disease. The key is to drink when you're thirsty and monitor your urine color. It should be pale yellow, not completely clear or dark yellow. Another myth is that kidney disease only affects older adults. While risk increases with age, kidney disease can affect people of any age, particularly those with diabetes, high blood pressure, or genetic predispositions. Young adults should be just as vigilant about prevention as older individuals. Some believe that if they feel fine, their kidneys must be healthy. This is precisely why kidney disease is so dangerous. Symptoms often don't appear until significant damage has occurred. Regular screenings are crucial regardless of how you feel. Let's also discuss the connection between kidney health and other body systems. Your kidneys work closely with your heart. Heart disease can damage kidneys, and kidney disease can strain the heart. This is why cardiovascular health and kidney health are inseparable. What's good for your heart is generally good for your kidneys. A balanced diet, regular exercise, not smoking, and managing blood pressure and cholesterol levels. Your kidneys also interact with your bones through vitamin D metabolism and calcium regulation. Poor kidney function can lead to weakened bones and increased fracture risk. Ensuring adequate calcium and vitamin D intake through diet and sunlight exposure, along with weight-bearing exercise, supports both kidney and bone health. The gut-kidney connection is another important relationship. Emerging research shows that gut health significantly impacts kidney function. A healthy gut microbiome helps reduce inflammation and may protect against kidney damage. Eating fiber-rich foods, fermented foods like yogurt and sauerkraut, and avoiding excessive processed foods supports gut health, which in turn benefits your kidneys. Now let's talk about early warning signs you should never ignore, even though kidney disease is often silent. These include persistent fatigue or weakness, difficulty concentrating, trouble sleeping, dry and itchy skin, increased need to urinate, especially at night, blood in your urine, foamy urine that doesn't go away, puffiness around your eyes, swollen ankles and feet, poor appetite, and muscle cramps. If you experience any of these symptoms, especially if you have risk factors, consult your healthcare provider promptly. For those who have already been diagnosed with early-stage kidney disease, the same prevention principles apply, but with even greater importance. Work closely with your healthcare team, which may include a nephrologist, dietitian, and other specialists. Medication adherence becomes critical, as does more frequent monitoring of kidney function. Dietary modifications may need to be more specific, such as limiting potassium, phosphorus, or protein intake depending on your kidney function level. However, with proper management, many people can slow or even halt the progression of kidney disease. Let's dive deeper into the dietary specifics that support kidney health. The DASH diet dietary approaches to stop hypertension is excellent for kidney protection because it emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy while reducing sodium, saturated fats, and added sugars. The Mediterranean diet shares many of these principles and has also been shown to support kidney health. When it comes to sodium, become a label reader. Processed foods, restaurant meals, and even seemingly healthy items like bread and canned soups can contain surprisingly high amounts of sodium. Cook at home more often using fresh ingredients, flavor foods with herbs and spices instead of salt, and rinse canned foods to remove excess sodium. For protein sources, consider incorporating more plant-based proteins. Beans, lentils, nuts, seeds, and whole grains provide protein along with fiber and other beneficial nutrients. Fish, particularly fatty fish like salmon, mackerel, and sardines, offer anti-inflammatory omega-3 fatty acids that support kidney health. If you eat meat, choose lean cuts and limit portion sizes. Potassium management is important, but for most people with healthy kidneys, potassium-rich foods are beneficial. Focus on whole food sources like bananas, oranges, potatoes, spinach, and avocados rather than supplements, unless specifically recommended by your healthcare provider. Phosphorus is another mineral to be mindful of. While essential for bone health, excessive phosphorus, particularly from processed foods and sodas containing phosphoric acid, can be harmful to kidneys. Read ingredient labels carefully and limit processed foods and colas. Fluid intake should be balanced. For most people with healthy kidneys, drinking when thirsty is sufficient. However, if you have specific kidney conditions or are on dialysis, your fluid needs may be different. Always follow your healthcare provider's recommendations. Let's address the emotional and psychological aspects of kidney health prevention. Taking charge of your health can sometimes feel overwhelming, especially when dealing with multiple risk factors. It's important to approach prevention as a journey rather than a destination. Start with small, manageable changes rather than trying to overhaul your entire lifestyle overnight. Celebrate small victories, a week of consistent exercise, choosing water over soda, or successfully managing stress with a new technique. Build a support system. Share your health goals with family and friends who can encourage and support you. Consider joining support groups for people with diabetes, high blood pressure, or other conditions that affect kidney health. Sometimes talking with others who face similar challenges can provide motivation and practical tips. Be kind to yourself. There will be setbacks and challenges along the way. What matters most is your overall pattern of choices rather than perfection in every moment. If you slip up, don't dwell on it. Simply recommit to your healthy choices at the next opportunity. Regular medical care is your ally in kidney disease prevention. Build a relationship with a primary care provider who understands your health history and risk factors. Don't skip annual checkups, and be proactive about discussing any concerns you have about your kidney health. Ask about appropriate screenings based on your individual risk profile. If you have multiple risk factors or a family history of kidney disease, consider seeing a nephrologist, a kidney specialist, for a comprehensive evaluation. They can provide personalized recommendations and monitor your kidney function more closely. Medication management is crucial. If you're prescribed medications for blood pressure, diabetes, or other conditions, take them exactly as directed. Don't stop taking medications because you feel better. And do and skip doses to save money. Discuss any concerns about medication costs or side effects with your healthcare provider. They may be able to adjust your treatment plan or suggest alternatives. Now, let's talk about the future of kidney disease prevention. Research is constantly advancing our understanding of kidney health. New biomarkers are being developed to detect kidney damage earlier than traditional tests. Genetic testing may eventually help identify individuals at higher risk before symptoms appear. Personalized nutrition and lifestyle recommendations, based on individual genetics and microbiome profiles, are on the horizon. However, while we wait for these advancements, we have powerful tools available right now. The lifestyle changes we've discussed, managing blood sugar and blood pressure, eating a balanced diet, staying active, maintaining a healthy weight, avoiding harmful substances, and getting regular checkups, are proven strategies that can dramatically reduce your risk of kidney disease. Let me share an inspiring example. Maria, a 52-year-old teacher, was diagnosed with prediabetes and high blood pressure during a routine checkup. Her doctor warned her about the risk to her kidneys. Instead of feeling overwhelmed, Maria decided to take control. She started walking 30 minutes daily, gradually increasing to an hour. She worked with a dietitian to create a meal plan focusing on whole foods, reducing processed items, and controlling portion sizes. She joined a meditation group to manage work stress. Within 6 months, her blood sugar levels normalized. Her blood pressure improved significantly, and her kidney function tests remained excellent. Maria's story shows that with commitment and the right support, you can reverse risk factors and protect your kidneys. Your kidneys don't ask for much, just consistent care and attention. They work tirelessly behind the scenes, filtering your blood 24 hours a day, 7 days a week without rest. The least we can do is give them the support they need to continue this vital work. Remember, prevention is always better than treatment. Dialysis and kidney transplantation are life-saving treatments for end-stage kidney disease, but they come with significant challenges, lifestyle restrictions, and risks. Preventing kidney disease from developing in the first place is infinitely preferable to managing its consequences. So let's recap the critical steps to stop kidney disease before it starts. First, control your blood sugar if you have diabetes or prediabetes. Monitor regularly, follow your treatment plan, and make lifestyle changes to keep glucose levels in check. Second, manage your blood pressure diligently. Aim for below 130/80ths, reduce sodium intake, exercise regularly, and take medications as prescribed. Third, adopt a kidney-friendly diet rich in whole foods, fruits, vegetables, whole grains, and lean proteins while limiting processed foods, sodium, and excessive protein. Fourth, stay physically active with at least 150 minutes of moderate exercise weekly, plus strength training. Fifth, maintain a healthy weight through balanced eating and regular activity. Sixth, avoid nephrotoxic substances, be cautious with pain medications, limit alcohol, and avoid illicit drugs. Seventh, quit smoking if you smoke it. It's one of the best things you can do for your kidneys and overall health. Eighth, get regular checkups and kidney function screenings, especially if you have risk factors. Ninth, manage stress effectively and prioritize quality sleep. 10th, be mindful of protein intake and stay appropriately hydrated. These steps aren't just about preventing kidney disease, they're about creating a foundation for vibrant, energetic health that will serve you well for decades to come. When you protect your kidneys, you're also protecting your heart, your bones, your brain, and your entire body. The journey to kidney health starts with awareness and continues with action. Today, right now, you can make a commitment to your kidney health. Start with one small change, maybe swapping sugary drinks for water, taking a 10-minute walk after dinner, or scheduling that overdue checkup. Each step you take builds momentum toward better health. Picture this instead: your kidneys are functioning perfectly, and you're living a vibrant, energetic life, free from the burden of preventable disease. This isn't just a possibility, it's an achievable reality when you take the critical steps to protect your kidney health. Your kidneys are silent heroes in your body's daily operations. Show them the care and respect they deserve by implementing these prevention strategies today. Remember, the best time to protect your kidneys was years ago. The second best time is right now. Take that first step today, and your future self will thank you for the gift of healthy kidneys and a healthier life. The power to stop kidney disease before it starts is in your hands. Make the commitment, take the action, and embrace the vibrant health that awaits you. Your kidneys and your entire body will thank you for years to come.